do you have some good suggestions for treating dental cavitations? What is your experience supporting clients with oxalate and salicylate sensitivity? So that's 3 different questions. Let's take the dental cavitations question first. Dental cavitations are where a patient has had a dental procedure and the cavitation has left the patient compromised in the area where the tooth was removed, oftentimes with a chronic infection deep down in the tooth. Carrie, do you want to add to that?
No. That cavitation is into the bone. Sometimes creates problems for people, gets infected and so on, but I don't see a lot of them in my practice, actually.
Right, and I don't either. The few that I've seen, there's a lot of research now that talks about how in cardiovascular disease that the dental source of chronic inflammation from bacteria growing underneath the gum and in the bone, even in the case of cavitation, creates a chronic low-grade inflammatory process that leads to the deposition of plaque and artery walls and creates cardiovascular disease and so on. And there are a number of papers that document that. So we know that the oral cavity is very important, and it is part of the whole body. One of the things you'll see in a tooth problem is you'll see, of course, any of the tooth techniques, which means neurological tooth technique. It could be injury recall tooth. These are things well discovered, well discussed in, I think it's session 6, is it not, Carrie? And
I believe it is session 6.
Session 6, right. And then you have NSB for the tooth or set point for the tooth. Well, you have patients with these chronic tooth problems, with chronic tooth infections, or whether it be that or a cavitation, or patients who got an abscess underneath the gum or below the gum, rather, I should say. And you have these patients who have these chronic problems sometimes, and they may require dental intervention. They may require some other type of therapy, even antibiotic therapy, whether it be natural antibiotics or whether it be prescribed antibiotics. But the tooth itself will show a positive pattern. It will therapy localize in the clear. It will therapy localize in an IRT pattern. It will therapy localize with a set point pattern. It will therapy localize in some form or another. And there are a number of products that can be used that are natural antibiotics that can be swished around in the mouth. One of the ones that people talk about that's more commonly known is Goldenseal. The berberines in Goldenseal can have an antibiotic quality, and some people swish I have patients who come into my office and they tell me their tooth is bothering, so they took some Goldenseal and diluted it a little bit and slushed it around in their mouth. There's a product by Michael Leibowitz's company, Supreme Nutrition Company, that's called Oral Defense, that has some substances in it that are designed for helping these chronic infections in the mouth. NutriWest has a product, 2 liquid products actually, 2 tinctures. The one is called Total BAC-T, Total-BAC-T, like Total Bacteria, Total Bac-T, and the other one is called Immuno Plus. These 2 products are liquids, and they are. I've used this before at the recommendation of my NutriWest representative. I've done this for years. Is you take these and dilute them and slosh them around in the mouth as well to help to control any oral infections. We test the patient to see which of those products they need, whether it be Oral Defense, Total Bac-T, Immunoplus, or any other substance, Goldenseal, whatever, and what they strengthen on, then we give it to them in a method where they slosh it around their mouth, hold it in their mouth, and help to reinforce the antibiotic quality that needs to be done in that patient's particular case. Now, an interesting thing about that is you can decide which of those products to use by going testing against the therapy localization that's present for the tooth problem itself. That is to say, if you have a neurologic tooth, the tooth will therapy localize in the clear, that is, making a strong muscle weak or weak muscle strong. When you find a strong muscle going weak when you therapy localize to the tooth, that weak muscle, that indicator then muscle, you test against the different products to see what negates that. We'll see later that you can actually use cytokine testing. The cytokines that we'll be talking about in the immune webinars 2, 3, 4, and 5 coming up in the next 4 months. We'll talk about how to use these cytokines. The ones Carrie was showing you on his shelf to test and identify specifically what type of immunological pathway is involved with the infection and or inflammation associated with that tooth problem or other organ problems, for example. We'll go into that greater starting in the next webinar in October. But the other factors are you can check to see if the patient has a IRT where they touch the tooth and the head back And if that causes a positive challenge, such that there's a weak muscle, now with that weak muscle, you test against the various substances that you might want to slosh around the mouth. Or if it's a set point, the patient touches the tooth and either you tap or the patient double therapy localizes to the stomach 1 point or occasionally the large intestine 20 point. And when you have that, then you test against that weak muscle that's created by that therapy localization to see which of the antibiotic probably works better than the others. The same thing with NSB. If you find a tooth that's got an NSB, you tap the tooth, it weakens the muscle, then you see which of these products negates it. So if you have a cavitation or a chronic tooth infection or a chronic problem with any tooth that might be infected or have abscess, it may require dental intervention and may require antibiotic intervention, as I say, from either medical or from a natural point of view. But you can test the specific thing against it for what the patient requires. This is the ultimate precision medicine that people are talking about, precision medicine all the time today. This is the ultimate precision medicine that's available to us as clinicians. Yes, we can look at the genes, and yes, we can look at the metabolomics and the proteomics and so on. But when it comes down to the exact individual patient's response to the exact specific product they need, precision medicine is found in muscle testing and using muscle testing as a tool for functional, neurological, and neurochemical evaluation. So we can use these tools in case of a tooth problem, for example, we've elaborated on, to identify precisely the product or products that might be most beneficial for that patient's rapid recovery. Beyond that, we always do want to work with the dentist because there are things that are dental in nature, and sometimes that's what the patient requires is dental intervention. And we always try to save teeth, but there are times when a tooth could be damaged enough that it needs to come out. So we definitely want to work with dentists, and I always hope to have a dentist or two in my neighborhood or in my town that I can refer patients back and forth with, and I've had that good fortune for a good number of years now. So they have understanding of the natural health care that we use, and they have understanding of the dental care that they use. Anything to add to that, Carrie?
Nothing to add except that the application of the procedures that are present in the QA protocol relative to teeth are very effective at controlling these issues, and then trying to fight any infection that might be present is an individual kind of item, as Wally pointed out. But make sure you understand the application of those procedures in relationship to the tooth, and that they stack on top of each other. One procedure will not show until another procedure is accomplished. So just understand that is the principle you must use when looking at tooth techniques, if you will.